In the next few minutes, I'm going to give you some secrets regarding stroke therapy. This presentation is brought to you by www.strokerehabonline.com. New advances in stroke therapy are helping stroke survivors more than ever. The extent of disability after a stroke depends on many factors, the degree of damage and the area of the brain that has been damaged. However, all hope is not lost. New discoveries in stroke therapy are shedding light on how best to recover. Stroke therapy usually begins in an outpatient clinic or private specialist centre. After a certain time period, stroke survivors are left to fend for themselves. Stroke therapy can be expensive and therefore a financial burden to have long, extensive, ongoing stroke therapy. This leaves more and more survivors and their families with shorter periods under professional guidance and looking to start some form of home rehabilitation. Stroke therapy at home is easier said than done. It can be very confusing to know what to do, how to do it, and for how long. A good starting point is looking at improving any deficits that a survivor may have. We can look at areas of the body and areas of the mind to make things easier. The body can be broken into the ability to move parts of the body and the ability to feel parts of the body. The mind can relate to deficits in ability to think, reason, and remember. Common issues with the mind can include memory problems, language issues, and spatial awareness. In the body, we look for any areas that are lacking sensation or feeling. These areas may feel numb to the survivor or have a feeling of pins and needles. There may be patches of skin that feel like this, whole limbs, or one half of the body. Also with the body, there may be areas that are paralyzed or unable to move. Although obvious, but tailoring treatment to these areas and concentrating on them can really help make stroke therapy more efficient. With the mind, depending on which hemisphere of the brain has been damaged, we classically get two common issues. Issues with language denote damage to the left hemisphere of the brain, and issues with spatial awareness relate to damage on the right side of the brain. A whole world of exciting and revolutionary stroke therapy exists. Unfortunately, the masses and the people who need it the most are usually not exposed to it. You can learn and perform cutting-edge and advanced stroke therapy in the comfort of your own home. Imagine the possibilities. For all the latest and best information regarding stroke recovery and rehabilitation, including how to design a cutting-edge stroke rehab program at home, speed recovery and improve function, check out the Stroke Rehab Handbook. Simply click the link down in the description below and learn more about the Stroke Rehab Handbook and how it can help your stroke therapy.